So Dr. Sajal Jain. Hello. Hello. Hello to everyone. I'm Dr. Jain. Today's topic is about stroke. For yourself or for your family, what can you do if they are on risk? If there are any symptoms, what they should do? Hopefully, this topic will help you all and it will help your family. So there is some fault, my slides are faulty, so I have to present it this way. So we will talk about the common types of stroke. There are 3 types of stroke. 90% of people
so in the brain, the artery or vein gets busted. The second number is ischemic stroke. There the blood clot forms in the blood vessel, and the blood doesn't flow. And this happens suddenly, and human is all right, or in few seconds this thing happened. And the last one, the most common, and they called it Astrochlorosis. Like you can have a plaque in the brain or in the blood vessel, and to have this it takes many years, and this is the most common type. In paralysis, what happens? There's a asymmetric, there's an asymmetric or drooping on the face. Their arms are weak, and they're having hard time to speak, and there is little drooping. We call this FAST, F-A-S-T, face, A arms, S speech, and T time. And the meaning of time is that you have to call the paramedics ASAP, like within half an hour. If you treat it, then you can get a full recovery. If it's within 2 years, and then many people get full recovery. So call 911 and tell them the patient is having this kind of symptoms. They will come ASAP, and then they treat the person ASAP, and the recovery is very good. How this happens? There are few places of brain where we happen it. The front here is the biggest lobe. It's called frontal lobe. What happens is the personality of the person changes. Some people get angry or paranoid, and they start uttering some words, and they can't understand. They want to say something, but saying something else. And the most common thing is it's the parental lobe. That's the middle part, and it's on the left side. What happens is arms and legs get weak, and then the common people knows about these things. And third person is occipital lobe, and which affects the eyes. This is the 1/3 on the back side. It affects the eyesight. You can't see from the eyes. Like you could see a white curtain on your eyes. And one person sees it, he sees all black, like this. Fourth place is the temporal lobe, which is regarding the memory. Like temperature and stuff like that. You could perceive this problem happening very soon. And slowly the plaque comes in, and then they have the memory problems. Fifth area is the downward. This is gray one. It's called cerebellar lobe, balance. This is regarding the balance. The people will have falls, frequent falls. So what are the risk factors? Stroke risk factors are same thing with the heart. People who have heart disease, they have chances of more stroke or more than that. And people who have already have heart attack, and when they have 8 to 9 times the risk stroke factors, if their cholesterol is more, if their blood pressure is high. Yeah, like I told you before, that the blood vessels ruptures, then there's a clot. If people have little bit of high blood pressure, atherosclerosis या plaque उनमें भी होता है, and I will make you understand afterwards. Like if you are very heavy, fat, don't do that much exercise. So most important, the one people we use CPAP machine, people who snore, those who have diabetes, like in our community. Luckily, people don't smoke that much, but people are going towards young generation is started. I want to say that they try to avoid this. The stroke chances increases. Or for the rest of all of the Punjabi community, dangerous thing is, risk factor is the alcohol drinking. If they drink alcohol, it's quite a bit of damage they are being done. They're being diabetic, cholesterol increases, blood pressure increases, and then the stroke chances increase. And then some people say, oh, like it's a blood thinner when you drink alcohol. So that's why I say heavy drinking. And how does it? I can make you understand that. Those people who drink more alcohol, the factor increases of heart palpitations. There is atrial fibrillation कहते हैं, जिसमें दिल की धड़कन बढ़ जाती है. Many people who drink alcohol, they get the atrial fibrillation because of the risk of blood clots. Like the blood clots increases. Like see the normal heartbeat, yeah. And there is another heartbeat. The upper chamber squeezes once, and then down also squeezes one. In the atrial fibrillation, what happens is the upper portion 400 to 600 times, and the lower portion cannot does it. So 50s, 100, 150. Because of that, the blood flow, it is not normal. When blood flow is not normal, somewhere chances are that the blood clot will be formed. So the atrial fibrillation, we find it in 40%. Some people have the alcohol drinking. So कुछ लोगों को अब खराटे ज्यादा लेते हैं, स्लीप एपनिया जिसको कहते हैं, कि ये होता है, blood pressure increase after the blood pressure increases, some because of thyroid, and after the infection, particularly the old age, when they have the urine infection, they happens. Like when coronavirus was going on, I could see the older person having atrial fibrillation too. And most risky factor is the people who have open heart surgery. Those who have done this open heart surgery, I have seen is 3 to 4 people have the atrial fibrillation, and that's temporary. But their stroke risk factors are there. And people who have the blockage in the heart, and they have the more stroke risk factors. And then there's a false pregnancy too. What happens in atrial fibrillation? That's what I told you. The upper portion, we call this lateral atrial fender. What happens is that there's a blood clot right there. When blood is clot over there, what blood is clotted over there, it becomes a blood clot. When it becomes more, then it goes to the main source and it goes further on. When it goes further on, it goes into the brain and then it bothers over there. That's why I told you earlier. That's the region. And the effects, which region it is. If it's on the back, it goes the eyesight. It's in the middle, the arms and legs problem have. It's in the front, it's the personality change. Then we go to the blood pressure. That we agree what blood pressure is. Like why it happens, because of the blood pressure. What happens is in the blood pressure, we see that the blood vessel is getting tighter. When it becomes narrow, like CU, it's over there. So it affects both the blood pressure. Upper number, ऊपर वाले को systolic कहते हैं, and तो नीचे, the lower number we call it diastolic. Both are dangerous. Diastolic window, and it's so small. If it increases a little bit, the stroke factor increases. If it's higher number, it's still, you can take time. What happens to the blood vessel? See, the blood flow is very fine, but see, the blood vessel is getting narrower. So blood pressure increases to maintain that from the narrower side. Because of that increase, narrowing, because of the increase in blood pressure, the cholesterol starts building. Like say you see the yellow thing over there. And that's a plaque. That's why you saw this, yeah, it becomes the blood vessel more narrower. And the blood pressure because of this increases and more deposit. And the blood vessels get damaged. When the blood pressure increases too much, I told you, the blood vessel ruptures. Yeah, the blood vessel ruptures. Yeah, I have made another diagram because of the brain damage. This is a genetic disease. We are suspicious that if less than 35 to 40, somebody has a brain damage because they don't even have a blood pressure disease. We see for there, like it's just like a balloon. The blood vessel increased. The blood vessel which increased to like a balloon, it's a genetic thing. It's going from heredity. It's from one generation to the other. Like if your son, brother, daughter, everybody should get checked. So if they don't have this, because today we can treat this. Those people who have the aneurysm, we can tell them and then we give them the appropriate treatment. This is more necessary. If anybody in your family is about 40, so they should get it checked. If they have a blood vessel rupture, blood vessel changes all the time. Blood pressure is normal, is 120 and less than 80. Low normal. So it won't damage your body. Both two important things are eyes and kidney. And always they affect that. So that's why we get the eyes as well as the kidney check. We do the blood test for kidneys and eyes. These are all separate stages. If it's stage 3 and above, then the rupturing of the blood vessel is great. What can we do after that? Once a week, you should get your blood pressure, not 10 times a day. You should talk to your doctor. Or if you think the blood pressure suspicious, then so you can check it for 1 week and then maybe twice a week. And how to check it, that's important. How to do this? Like, see the person sitting in the chair. Blood pressure cuff is on her arm and 2 fingers beside the elbow joint. And it shouldn't be more tight. What level? It's at the heart level. And person should be sitting quietly, no talking. First, take the initial one, measure it, check it second time, and then check the second time. And the palm should be open, hand. It shouldn't be a closed fist position when checking the blood pressure. And the leg should not be crossed, because this is the arm blood pressure technique. Some young people have the wrist pressure. People who are 60, 65, I recommend not to use the wrist one. Because the wrist one is not that accurate if it's black. The people who check it, yeah, they should keep the arm like this. If it's a chair, dining table, put your arm elevated close to the heart. That's the best thing. It's a good, check the good blood pressure. And the best way is to keep your log. Most important is, if you have to help, 1 to 2 times morning, you check your blood pressure, and afterwards, before going to bed. Make sure that you haven't eaten anything. Yeah, then make sure it's normal blood pressure. Then we are going to another topic called cholesterol. I have used the international unit over here. If you're following the Canadians, divide it by 40, that's fine. Cholesterol level is very important. It should be less than 5 or less than 200. We say it borderline. Between 5 to 5.5, it should be close to that. If it's 5.5 and above 240, we say it's a wrong reading. The cholesterol, what it does, I have told you earlier. Yeah, the yellowish one I'm showing you, that's all cholesterol. And it clings to the wall of the blood vessel, and you see it. And the blood vessel gets narrower from the inside, and the blood flow is less. And when it's more than 80% blocked, and then the blood vessel gets affected, where it is less blood flow, it starts getting, if it's very small, then it goes till 90% even. You can see this profile. You could see this. It's like how the blood flow is being reduced. When we see the cholesterol, we have used this 3 things: good, bad, and the ugly fire. There's one HDL, LDL, and then the third one, triglyceride. I put this picture. So the one which is HDL, that's a good cholesterol. Like it extinguishes the fire. The plaque is less. The one LDL, it says fire. It's a plaque is made by this LDL. And the triglyceride, it's like putting oil into the fire. This is important because when we check the profile, we give a range. One HDL is more than 1.5 or 60, international score number. If it's 60, more than 60, it protects us, like extinguishes the fire, just like a fireman. It acts like that. So it lowers it. The bad one, triglyceride and LDL. The triglyceride is one. It's regarding our food, like what we ate within 3 foods, because our cholesterol increased. or what alcohol, how much alcohol we have used. Some is genetic, some is always number. They always have this number. Astrochlorosis bacteria खतरा बढ़ जाता है, or if it's more than 10. The most dangerous one is this one, LDL, which has a plaque deposit. So when 5 or more than 5.5, first we tell them to control it by diet. And then we see how much is your risk qualification. If you don't have any disease, then we say your risk is low. Then we want to keep it less than 4.55. If somebody is diabetic, then we say them 17, less than 17. If somebody has heart attack, or family has a strong history, or they have stroke, less than 1.2 or less than 1.7. That's our gauge. That's a guideline. That's a guideline we follow. I've told you earlier how to avoid this. Dietitian will tell you more about it. So I won't take more time. The most important is, so whole grain wali cheezein khaएं, साबुत अनाज wali cheezein khaएं. Alcohol and smoking should be avoided. Our next risk factor is diabetes. And this is very prevalent in Southeast Asian. And if in the whole world, if you see the percentage is Southeast Asian is more. Why diabetes is important? Because the risk factor of heart disease increases by three times more for the heart. So that's why to control it is very important. What are the causes of diabetes? I told you earlier also, we had talked about it. Obesity, blood pressure, their diet is bad, they don't do any exercise. And to some extent, the age also, and the family. What happens is, the blood flow should be like water. When the diabetes is there, the blood pressure is just like a honey viscosity. It's like honey. It's very slow. So the blood is thickened. Because of thickening of the blood, there's a more plaque formation, or the risk of blood clot is there. And because of this, the risk of stroke is increased. What body does is, there are some chemicals involved. You say, when the sugar is there, the blood pressure increases, and the cholesterol starts increasing. And there is inflammation in the body too, and blood vessels. And because of this is happening. This is the process going on in the body. Astrochlorosis या खून जमने की बीमारी है, और अगर समझ नहीं पा रहे, इसलिए मैंने उनके I have kept a slide for them. And to get this formation, it takes 3 to 5 years. It doesn't come in overnight. And because in some cases the blood increases, sometimes it happens in overnight or 1 to 2 days also. That's the difference. For diabetes, how we handle this? Diabetes, many ways. The common way is, the guideline is the worldwide. That is HbA1c. If your sugar or diabetes number is less than 6 or 5.7, or 6, 6.1, 6.2. Yeah. Then we think that you are on the stage, you may have diabetes. If you control it, there you will be fine. Then it will come towards normal. If you don't control it, then it will go towards the diabetes level. When we start the medication, when it's the number comes above 7, the people who are more obese, and we can start medicine on 6.2. Hemoglobin A1C is international. Everybody can take medicine. The numbers which I've told you, the one we check the sugars, that's different. If it's 6, 7, or whatever the numbers. India, US, we use 100, 110, 120, 200, 250. What's the difference? What number we use in Canada? We divide it by 18. Multiply by 18. Then you get the international numbers. If your fasting sugar is 10, so according to US, it will be 180. That's a conversion. If you are having diabetes or not, we can check it through 4 ways. If you have diabetic or not. The first one is A1C, hemoglobin A1C. And that's what I told you. If it's 6 or 6.5, if it's surrounding 6, we tell you that you control the diet. 6.5, we tell you to start taking medications. The other way is fasting sugar. If your fasting sugar is more than 7, if some say it's around 7 point, it's more than 8.3, then we tell them that you have diabetes. Third way is, it's called glucose tolerance test. He give you a sugar solution, and after half an hour, first before we check the sugar, and then after taking the drink, and it's a water with sugar in it, and we check your sugar afterwards. And then after 2 hours, after 2 hours, sugar should be 10.3, or it's more than 200, then we say you have diabetes. Fourth way is random. We check the random. If your sugar is more than 10.3, then we say that you almost have sugar diabetes. What should we do in between? You should check your sugar first time in the morning. First is a finger device. That's very good. The second system is the best one. That's called glucose continuous monitoring system. Yes, there's a black pump. So 24/7, it tells you the reading and how your blood sugar is going on. Like it goes, the white thing can goes in their arm or somewhere other part. It stays there for 1 week. And you can include it with your pump or touch it with a cell phone. It will tell your diabetes number. It doesn't mean that you're going to check your 24. So just check your morning. Whenever you eat something, then you can check it. After 2 hours, you can check it. If this device you have used in my patients, very good for them. So they can know, like if I've eaten this thing, my diabetes number are this. Then you can restrict yourself that I shouldn't eat this thing. I shouldn't eat this, or I shouldn't eat this. If I eat this, after 1 hour, my sugar goes this one. Or even after 15, 20 minutes, the sugar level goes high. If it's sugar low, you can also check it then. This devices are made by different companies. There's this Freestyle Libra. The other one is Dexcom. And slowly, the technology is getting better. There's a blood sugar chart. That's the best. if you're not continuous monitoring, and you make your chart, first morning fasting for 3 days, then another 3 days, after lunch 2 hours afterwards, check your sugar, and then after dinner 2 hours after dinner, what number you are getting, and doctor will check it after every 3 months. A1C, how much is your A1C? If you're diabetic, every 3 months you check. If you are pre-diabetic, we check it every 6 months. What's the normal? Whatever we eat, whether that's appropriate or not, after 2 hours, normal sugar, it's 120, 140, between 6 and 7. After immediately eating that food, if you are pre-diabetic, impaired the glucose, their number goes above 10, like around 8 after 2 hours. If they're diabetic, their number is up around between 12 and 15 after 2 hours. It's always above 10, whatever they eat. That's because they had sugar in there. They should avoid that. And people who are on insulin, it means the insulin is less, or they should go for another type of insulin. And for this, they should talk to your doctor about it. How you can help your doctor? You can help your doctor. Then the one which I told you can do this, making a chart. What should we target? Fasting, less than 100, so less than 7. After eating food, less than 10 after 2 hours. And before, like around sleeping, it should be at 7.5. And 3 months average should be around 7. If we don't keep this, then the complications will start increasing. Aankhon ko takleef, it will affect your eyes, retinopathy, and then the nerves of eyesight or blood vessel towards the eyes might be broken. The kidneys damage will be there. Some people, their feet gets numb, they feel the burning. Those are all the complications of diabetes. If people control the sugar, after 10, 15, or 20 years, if they don't control the sugar, they have these all symptoms in 5 years. What should we do about it? Avoid diabetic complications like stroke, heart attack, eyes problem, kidneys problem, and they can even go on dialysis. And then it takes a long time. So you should avoid these, like exercise, diet. So the one who the rest of my colleagues told you, I thank everybody. I say thank you. Please take care of your health and help doctors. Thank you.